Hello guys, welcome to a new session of MEDICO XYZ. Today's our topic of discussion is respiratory system. In this section we will discuss lung pathology and we will discuss congenital anomalies, acute respiratory distress syndrome. For the start guys, we will first congenital anomalies we will discuss is bronchopulmonary sequestration. What is bronchopulmonary sequestration? It is a separate mass of lung tissue that has no connection to the normal airway system. It means a separate mass that is present within the lungs or outside the lungs. Lungs means it is lung parenchyma. It must be gets its blood supply. It gets its blood supply from aorta. Now the types of bronchopulmonary sequestration we will discuss earlier that it can be of present within the lungs or outside the lungs. Hence the classification is intralobar or extralobar. This bronchopulmonary sequestration can lead to or predispose to infection and bronchiectasis. We will discuss bronchiectasis later on. Now we will discuss atelectasis. Atelectasis is a very important topic. It generally means the collapse of the already infected lungs, or in case of neonates, it is incomplete expansion of the lungs, or collapse of the already infected lungs. It is the definition of atelectasis, means if the lungs is already inflated. Uh, if the lungs is already inflated, atelectasis means it is the collapse of that lungs. Or we all know that the lungs of the neonates are collapsed already. So in case of neonates, atelectasis means it is the incomplete expansion of the lungs. So what are the types of atelectasis? It is of two types, hereditary and acquired. In acquired we also have three classifications: resorption, compression and contraction atelectasis. In resorption atelectasis, what is resorption atelectasis? It is a reversible atelectasis. Means it can be reversed by changing the underlying conditions. What is the cause of resorption atelectasis? It can be due to increased oxygen absorption into the dependent part of the lungs. Means dependent part means due to gravity, the oxygen is stored in the lower portion of the base part of the lungs. What is the cause of the resorption atelectasis? It is the bronchi section, and in bronchi there can be mucus plug formation. Mucus plug can block the bronchi, or it can be aspiration of foreign body, or it can lead to bronchial neoplasm. Neoplasm means tumor. Uh, Now, due to atelectasis of the collapse of the lungs, the mediastinum means the space between the lungs. It shifts towards or away. It shifts towards atelectasis. Now we will discuss compression atelectasis. It is also reversible as resorption atelectasis. It is due to increased pleural fluid within the pleura. It is also known as pleural effusion. What are the causes of compression atelectasis? It can be due to pleural effusion or tumor mass or the pneumothorax. Pneumothorax means expansion of pneumo. Pneumo means air within the lungs. Pneumo means air within the lungs, within the thoracic cavity. Air within thoracic cavity. So that here we can see the fluid is accumulated within the pleura, and it pushes the lungs, and the mediastinum shifts away from the atelectasis. Now, contraction atelectasis, it is also irreversible. It is due to fibrotic lesions of the lung. Now, coming to the clinical significance of atelectasis, it can lead to decreased oxygenation. In here we can see the compression resorption atelectasis. There is oxygen accumulation within the dependent part. Here the apex part is free of oxygen, hence it can lead to decreased oxygenation, and decreased oxygenation means hypoxia. Hypoxic state leads to increased risk of infection.